Do you have a child that's irritable all the time, that doesn't behave, that is combative, that never wants to listen to you? Well, most of us expect that when they're teenagers, but if you have a several-month-old child, a year old or 2 years old or 3 years old, and you're dealing with this sort of things, often it's an indicator that they just don't feel well. Think about how you are when you're irritable. Why is it? It's usually that you're overworked, your energy isn't good, you're fighting something, your resistance is down, and you just can't deal with the things in your life. So kids that have colic, they aren't just crying for the heck of it. They're crying because they don't feel well. And so what we found in our upper cervical chiropractic clinic, we've taken care of lots of kids over the years who have irritability issues, colic, chronic ear infections, speech delay, things of this nature. And often what's happened is during the delivery process, because it's inherently kind of a traumatic process, their upper neck has dislodged, especially this top vertebra called the atlas, right where the head sits. Inside of it is the brain stem, which controls basically everything in your body. And anyway, if also kids that have been forceps delivery or vacuum extraction, that type of delivery often saves the kid's life. But when it's done, there's 120 pounds of force that is introduced to the head-neck junction, which obviously can structurally dislodge that atlas, and it can irritate the cord, and that can set up the stage for a child to have all sorts of issues. Yes, right from the get-go. I've seen many kids. Had a kid 5 years ago, 30 days old, who had ptosis of the right eye. The head was off center. The kid wouldn't feed. They were pale. They wouldn't sleep. All they did was cry. And again, it's not the kid's fault. He just isn't working right. And so in this child's case, it was the top vertebra in the neck that was locked. We got that kid corrected, and rather quickly things changed for the better. So if you have a child that you know shouldn't be acting or behaving or functioning in the way that they are, and you don't want to go the route of giving them medication and anti-anxiety medication and sleep medication when they're just a little kid, and you know there's got to be a better way, one of the things you can look into is upper cervical chiropractic, which focuses again on the upper neck and getting the nervous system, which controls everything, working the way God intended it to, so your kid can be the happy, smiley, happy-go-lucky entity that they were designed to be.